Hi, I'm Kate Marie from Slow Aging. As we get older, our tissues start to shrink and we lose a lot of the elasticity and collagen. Our collagen fibres get all tangled. So what we're doing here is we're having a rejuvenation procedure using my own stem cells. So several weeks ago I had fat harvested from my back and that was sent to a lab, and now I'm here to get those stem cells that have grown injected into my face. Now this is not about having a facelift. This is about trying to stimulate my tissue to grow and to, I guess it's to look more youthful. So to gain some of the, to get the tissue to become a little bit more younger, or to stimulate more collagen growth and elastin growth. So apparently this might last or might stimulate stuff for up to 8 years, but no one knows, it's fairly new. We're just setting up now. I'm just about to get some numbing cream on my face. This procedure involves injecting these stem cells back into my face, so it's not without pain. Numbing cream.
Most important thing is to make sure we got the right specimen for the right patient.
Yep.
So that's why you need to identify that this is exactly you.
How much have we got here?
50 million stem cells.
Oh, okay.
And they're pure stem cells.
Yeah.
They're not the mixed population of stem cells that is sometimes referred to as stromal vascular fraction. These are pure, isolated and cultured stem cells from your own cells.
So you put them into these areas here. Which areas in particular?
Well, it depends a lot on the patient as to where they want to be treated.
Yeah.
But primarily the key elements really is in the area of the cheeks, around the eyes. Some people would like it in their neck or maybe in the back of their hands.
Yeah.
So it really depends on where each individual is looking to have the treatment performed.
Right.
Yeah. So with you, primarily about cheeks and this lower part of your face.
Yeah.
Did you want somewhere around your eyelids?
Sure. How painful is it?
Oh, it's not that painful. It's only a very small needle.
Yeah.
And there are two techniques.
Yeah.
One is where you do multiple little injections.
Yeah.
And another is where you might have one entry point, but you'll fan the product around underneath the skin. And the advantage to that is, and that's the one that I prefer, the advantage to that is that you have fewer needle points going in, so very fewer times and it's going to hurt.
Right. Okay. And when you, does it go just under the, which part under the subdermis is it called?
Into that subdermal layer.
Yeah.
Some people call it the subcutaneous layer.
Right.
And that's where it goes, between the skin, the fatty tissue, before you get to the other
right.
Because it's the fat, which is the active tissue, that's where the product retains best to be able to push the stem cells up into the skin.
Right.
And the other element that we use to direct the stem cells up into the skin is to do a laser treatment over your face after the injection.
Right.
Because the laser incites a reaction in the collagen of your skin, which draws the stem cells up. Our product comes from the laboratory, packed in a special container. We get the patient to identify their details to make sure that it's the right sample. Now we then go through a process that we make up the stem cells, and in here we've got our stem cells and a little bit of local anaesthetic. We're going to inject that into the area as we go. We've got one for one side of the face, and then we've got another for the other side of the face. What I'm going to do now is to put in some tiny injections with some local anaesthetic into the areas where I'm going to put the needle through. There is some local anaesthetic mixed in with the stem cells as well, so when it's going in it should not be particularly painful or bad.
Good.
Okay.
So there's the local anaesthetic doesn't interfere with the stem cells?
No. The areas that we're looking at treating for you, we discussed before, is across your cheek and this lower part of your cheek, is that right?
Yes.
And a little bit around your eyes. That's where we're going? Okay, good. We put in just a tiny little bit in this spot. Put in a little bit just down here, because that gives us access to this area of the face. It gives us access to this area of the face. A spot right here on the edge. The key areas in somebody's face that tends to show the aging is this area here we call the malar fat pad, and as it dissipates with age things tend to come down. That impacts on the contours and the quality of the lower eyelid skin, and in the lower eyelids the skin is the finest and most delicate in the body, so it shows the effects of aging quite readily. The lower part of the cheek and the outer segment is usually not quite so affected from an aging perspective, but towards the middle it is, because this is the area under maximum movement when we're smiling and when we're making facial expressions. It just gives a big smile there, Kate. You can see how this is the area that moves quite a lot. Just draw your corner of your mouth sideways. That's it, and you can see this is just relax now, that's the active part of the face, and so this little segment in here is really where the majority of the aging effects take place. We're going to do our injecting in those areas. Now, we don't need to place stem cells in every single spot to get a result, because the cells are living organisms and they migrate to the areas that need the repair, and that's why we use the laser stimulation on the superficial areas of the skin to draw those stem cells upwards into the skin, and they'll spread through the area really quite nicely. First injection we're going to go in through here. Did you feel that at all?
No.
Okay, now we're in a very superficial layer and just going to lay down a little bit of stem cells just through there. And you can see how I'm fanning out this whole area. And you can see underneath the very fine skin of the eyelid that you can see it going in really quite readily. You might feel this a little bit awkward. You can see the product going in through there. So as you can see, these are the key areas that we would normally look to inject. Everybody has concerns about these little crow's feet lines, and so if we inject some of our products through there, there's a small bruise just coming up in here, and that's not too surprising given the type of tissue that we have. Now I'm going to come down to here, and we're going to head up towards the top lip. This is the area we call the nasolabial fold, and you can see that we're just placing very small quantities of this lovely stem cell mixture throughout the key areas of the face. And you can see that we're concentrating on those most age affected areas in the face. I'm going to run in here towards the lower lip, and it's this little corner of the mouth that is often subject of a lot of aging concerns. Now remember, the objective of this treatment is not so much to create volume, but it's to create an improved textural effect and a quality effect of the skin. And you can see from these few portals, I can actually get access to that whole area of the face, right across that central part of the face. You always find that you tend to do things subtly differently on the left side to the right side, and that really just reflects the fact that the operator might be either left-handed or right-handed. This is the area where it's a little bit more tender and sensitive, because this tissue is just simply thicker and firmer. Now, one of the other advantages to this particular style of stem cell facelift and this injecting technique is that we don't get a lot of bleeding, and so the patients don't look frightful when they leave. Certainly there's a bit of bruising, and that can occur anytime there's an injection into the face, and that'll occur with any technique. But one of the advantages of this technique is the very few injection portals that require that allow us to cover the whole area that we're looking for. If we decided that we needed to treat the forehead, well then you'd have another injection portal here and probably here. Similarly on the other side, if we're injecting the neck, we'd have a series of portals through here, same on the other side, and particularly with a long needle, that gives us the ability to get all the way across. So our selection of technique and our selection of injection points depends entirely on what we're looking to treat for the patient. So this element of it is all done now, Kate Marie. And what we're going to do in a minute is to get you off to have your laser done. And
what sort of laser is it?
It's what we call a non-ablative laser. We'll be using the laser genesis, which is a type of laser that's designed to improve texture and quality of complexion. So the treatment with the laser is often used on its own for those purposes. When we use it in conjunction with the stem cell facelift, we actually get really quite a remarkable result, because the combination of the laser collagen stimulation and the effect that that has in turn on the stem cells is really quite extraordinary. So that's where the big value comes.
So is it, what sort of, technically, what sort of laser is it?
It's what we call a 1064 long pulse laser.
Right.
Yeah.
And how painful is it?
It shouldn't be painful at all.
Thank God. Hi, I'm talking to John now about aftercare, because I'm going off to another practitioner to do the laser. So John, what do I do for aftercare?
Okay, well, as far as the stem cell elements are concerned, these injections we've just done, you shower normally, you wash normally, you can massage if you feel any little bits of swelling at all.
Okay.
That's really not an issue. You can put makeup on, that's no problem either. So there's very, very little post-operative care that's required at this point. What you might feel over the next few hours or even few days is a very, very light, tingly type sensation in your skin. That's actually a good thing if you feel that. Not everybody gets that, but if you do, it's nothing to be worried about. It's actually a very good sign. Now the next step, as I mentioned before, is we're going to use our laser, our 1064 laser, to stimulate the collagen production, and really it's like putting the icing on the cake for this particular issue. So it works well, and there's no downtime from the laser either, so it's not a burning laser. It's a laser that'll leave you a little bit flushed and blushed for 3 or 4 hours, but apart from that, nothing at all. You can still use your makeup normally and go about your normal activities without any problems.
Okay. When will I expect to see some sort of results, and what would those results be?
In the early stages, what you'll notice is just a little sense of plumping of the skin, and that'll occur over the next probably 3 to 4 days, and that'll be a combination result of what we've injected plus the laser. Then things will settle down a little bit, and you probably won't notice much of anything except that your complexion looks fresher and brighter. But progressively, over a course of some months, the stem cells kick in and they start to work nicely, and that gives you a really lovely feel to your skin. It gives you a better complexion, better texture. It's important to understand that the stem cell is not for putting volume in, so it's not the same as a filler. It's not designed to do that. It's to look at skin health and texture and complexion, and in that sense it tends to do it really, really nicely.
Okay, thank you, John.
That's
Thanks
right.
for everything.
Okay, Marie, I'm Sue. I'm
Hi,
one of the
Sue.
nurses here at Dr Flynn's clinic, and now that you've had your stem cell treatment, we're going to use the laser genesis to actually stimulate more collagen and to help to activate those stem cells. This treatment is really comfortable. I need to put some protective eye shields over your eyes, okay? And at the same time I'll be wearing some glasses to protect my eyes. And all you'll feel is like a little tingling sensation, and will remain just in one area at a time until it becomes slightly warm, and then we'll pass on to the next area of your face until that becomes warm as well, until we've actually treated your whole face.
Do I tell you when it's warm, or do you know?
On the handpiece of the laser here, there are some little sensors that will actually change colour, so that will tell me when your skin is getting to a certain temperature. So it helps for remodelling collagen.
Right.
And so normally you would have a series of these if you're trying to rejuvenate the skin.
Right.
A series of 6 treatments, okay? However, though the light is an indicator of the temperature of the skin, if it does become too hot, you need to tell me, okay?
Sure.
Okay.
Thanks, Sue.
That's all right. So I'll pop the eye shields on first. So this particular laser machine has 2 types of application, one for treating vascular and one for treating pigmentation, and then we've got the other part of the machine which is for rejuvenation. So I'm just going to swap the wavelength to the wavelength that we use for rejuvenation. So when we actually start the laser treatment, I'll just be moving the handpiece slowly across the face, and as you can see the lights have already come up, even though the machine's in standby at the moment. Once the machine is operational, the lights here will change colour to indicate that the temperature of the skin is actually changing.
So I've finished the treatment with the Genesis laser, which is made by a company called Katira, which is a very good brand. And in fact, it was a lot less painful than I expected. It was quite comfortable, which is what Sue promised me. The good thing about these good machines is that they have a lighting system that enables the practitioner to know when the tissues have been warmed to the right temperature. Some of the imported machines, this industry is quite unregulated, which is a bit of a problem because people are importing their machines and they don't have the same safety attributes that some of the more sophisticated machines have. So patients are getting burnt and they can get hurt. So Sue, what do I do after this laser?
Okay, so with the laser, it's important to wear sunscreen, obviously. Treat your skin gently. I mean, we always advise that you wear sunscreen anyway because it's part of your anti-aging routine. But just be careful with hot showers, that kind of thing, for the next 24 hours. Don't go in a sauna or spa or anything like that. But generally speaking, you can use your normal skincare range, that type of thing, and just carry on as normal. It's recommended with the Genesis that you have about a course of 6 treatments to really get that collagen stimulation. But today what we've been trying to do is really boost those stem cells to get the very best result from your stem cell treatment. With regard to exercise, I would ask for the next 24 hours that you probably don't do anything too strenuous as far as exercise goes. With exercise, if you get too much of the blood pumping really hard, you tend to get a bit of inflammation, you tend to rub the skin. So for 24 hours, probably avoid any really physical exercise. Yeah.
All right, thank you very much, Sue.
My pleasure.